investment of resources, prayers, and guidance has played a crucial role in shaping these graduates into the remarkable individuals they are today. The Registrar and CEO of Medical and Dental Council message to inductees today is a big congratulations on this momentous achievement. This moment is not merely a celebration of your arrival at a destination, but however, is the commencement of your journey in medical practice. Enjoy this honor, but remember, the true work begins tomorrow. I am to remind you that you are stepping into a profession that demands not only knowledge and skills, but also empathy and integrity. Every patient you encounter is a unique individual deserving of respect and care. Therefore, approach your practice with humility, kindness, and commitment to patient-centered care. Now, the healthcare landscape is ever evolving, and you will undoubtedly face challenges that will test your resolve and ingenuity. Embrace these challenges and opportunities for growth and innovation. Therefore, be advocates for your patients, champions of public health, and leaders in your communities. May I also remind the inductees that medical profession is procedural and hierarchical profession, and their seniority. You must respect your seniors and your teachers, whether in professional gathering or in social gathering. And additionally, respect should be what? Mutual and reciprocal with the healthcare team. There are other healthcare teams that we work with them in the hospital. We have nurses, we have pharmacists, we have laboratory scientists, we have physiotherapists, a lot of them. The way you want to be respected, you must respect them too. Now, after today's induction, certificates, of which you will use those certificates to create an account on the MDC centralized housemanship placement portal, and subsequently select the available hospitals of your choice for your one-year mandatory housemanship. This is a critical step in your professional journey, and I encourage you to immerse yourself fully in this experience. You are required to complete your housemanship within 2 years of your registration. So if for any reason you could not do that within that 2 months, 2 years, or 24 months, you must make sure that you have a genuine reason beyond reasonable doubt to convince the registrar that you are still competent to what? To continue with to proceed for your housemanship training, or else the council will subject you to an assessment exams, and you have to pass that exams before you proceed for your housemanship. Why will council subject you to the exams? So as to revalidate your basic medical knowledge. So don't waste time. Once you get your provisional registration certificates, proceed for your housemanship. Now, the housemanship portal that I mentioned earlier contains only federal hospitals at the moment, and these are 45 in number. However, you are free to approach fully accredited state government-owned hospitals, military hospitals, and private hospitals for your housemanship placement. Now, in total, there are 115 accredited hospitals for housemanship across the country. In all accredited hospitals combined, there are enough spaces to accommodate all house officers in Nigeria. So you have no reason to wait until your full registration, provisional registration certificate expires, and then you'll be subject to exams. Just find where you can start your housemanship, unless you want to choose. Now, this message is for the parents and guardians. Please allow your children to imbibe best practices during this housemanship for the next 1 year. It's a very important moment for them. They are still in training, and in the practice of medicine, skills are very important, and skills have to be hands-on. Now, for the inductees, at the end of your housemanship training, you will receive a certificate of experience. That's your internship forms, of which you will use that to apply for your full registration certificate. And you know, without that full registration certificate, you won't be allowed to proceed for a national youth service, and you'll be allowed to practice medicine. So, And after your housemanship, you'll be fully registered. Once you are fully registered, you can practice on your own. However, you must know your limit, and you must know when to refer your patients and when to seek second opinion from a senior colleagues. Don't say that because I'm fully registered, I can do what I want. You will end up in one of the disciplinary organs of the council. Now, in the course of your studies and practice, it is expected that you will develop an interest in a particular specialty. You want to be a neurologist, want to be a neurosurgeon, cardiologist, cardiothoracic surgeon, gastroenterologist, endocrinologist, urologist, you want to be like a provost, obstetrics and gynecologist, pediatrician, want to go to lab medicine, chemical pathologist, histopathologist, medical microbiologist, any specialty of your choice. After you might have done that successfully, you must register that specialty before practicing as a specialist. Because we know there are many specialists who are practicing without being registered with the council. So don't do that. Register your specialty before practicing as a specialist. Otherwise, God forbid, if anything happens and you are brought to any of these disciplinary organs of the council, you regret it. So once you specialize, you have to do that. And you must specialize, especially if you remain in the hospital corridors. Because the era of general duty doctor is gone. You must specialize. You must specialize. So in whatever you do, you are also ensured to what? Renew your license every year. Don't wait until 31st of December, 11:30 p.m. You want to register. You start complaining us that the council portal is epileptic. No, our council has never been epileptic. The problems is from you. Why are you waiting till 30th December, 31st December before you renew your license? After all, you can renew your license at any time of the year. Why will you wait till that time? So you must renew your license at the end of every year if you are practicing medicine. Now, all this registration I've mentioned earlier, you can do all this fully on the respective portals. Do not lend yourself to any scam by paying money to someone who claims to be helping you. You can do that. You can pay directly on the portal. If you find any difficulty, send an email to the official email address of the council and seek guidance. Now, may I remind the inductees that medical profession is the most highly regulated profession in the world. Right from education, your practice, registration. Therefore, the profession is done under what? Close watch by colleagues, members of the general public, and the regulatory agencies. So, any report of infamous conduct against a doctor in a professional regard will be what? Duly or thoroughly investigated. Now, in case of Medical Dental Council of Nigeria, there are two disciplinary organs. We have the Medical and Dental Practitioners Investigation Panel and Medical and Dental Practitioners Disciplinary Tribunal. Now, the Medical and Dental Practitioners Investigation Panel is saddled with carrying out the responsibility of what? Alleged professional misconduct. It's a preliminary investigation. That is why the council doesn't allow the public or the press to join that panel because it's just an allegation. So if there's a prima facie evidence established against a doctor, that case is now transmitted to what? To the Medical and Dental Practitioner Disciplinary Tribunal. So if there's no case, if the doctor has no case to answer, that doctor is discharged and acquitted there and then. Now, the Medical and Dental Practitioners Disciplinary Tribunal has a status of High Court and can what? Order a range of sanctions, including what? Complete erasing your name from the register. You'll be deregistered from the council's register. Once, why? In case of grave offenses or gross professional misconduct. For example, maybe as an orthopedic surgeon, you are to maybe do below knee amputation of the right limb, right lower limb. You went ahead and done for the left. Medical profession. I solemnly pledge to dedicate my life to the service of humanity, the health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit consideration of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students respect and gratitude. That is their due. I will share my medical knowledge for the benefit of the patient and the advancement of the healthcare. I will attend to my own health, well-being, abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, upon my honor. Congratulations, my colleagues. I, Dr. do sincerely and solemnly declare that a registered medical practitioner of Nigeria, I shall exercise the several parts of my profession to the best of my knowledge and ability for the good. An ability for the good, safety and welfare of all persons, committing themselves to my care and attention, and that I will faithfully obey the rules and regulations of the Medical and Dental Council of Nigeria and all other laws that are made for the control of medical and dental profession in Nigeria. So help me God. All right. God. Congratulations. All right. Now the next is the three traditional bows. You know, whoever helps in life, we need to be what? Grateful to that person. We need to be grateful to God Almighty, who made all of you to see this day today. To be grateful to His Excellency the Governor of Ebonyi State, to the Vice Chancellor, Professor Michael Botawoke, represented by Deputy Vice Chancellor Administration. Sir, may I respectfully and kindly request the representatives of the Vice Chancellor to stand and receive this bow on behalf of him and the state government. So after the count of three, we give this bow to him. I hope you know how to bow. The next is your teachers. I know not all of them might be here, but some of them are here. You know, when you came to MBBS, maybe 1, 2, 3, so many things. A lot of medical terminologies that you don't know. They will teach you today. When you come to what rounds tomorrow, they will ask you. The lecturer will give you 20 complications of CCF. When you come back tomorrow, some cannot mention 3. You will be angry. But I know some. Like, he's not here today, who taught me in the university, Dr. Eni. Doesn't insult in what rounds, theaters, anywhere. Doesn't. I don't know if he has changed, but yes. So, you need to be grateful. 2, 3. Thank you very much. The last but not the least, your parents who have spent a lot, who have given you support, all the support, mention them. Spiritual, financial, all the support, you know. I know some of you, not all, some of you might have lied to them, you want money to buy cadaver. If you grew up in a village like me, you lie to your parents. But those that went to school, you can't lie to them now. Like, distinguished professor, if you tell you want to buy cadaver, just be looking at you. Or for what that grew in the village, we can tell them lies and they still give us money. They have done a lot to you. To be grateful to God Almighty and grateful to them. You know where your parents are. So you can turn and give them this bow after the count of 3. 1, 2, 3. Thank you very much. The Vice Chancellors are represented by Deputy Vice Chancellor Administration, the Provost, other Principal Officers of the University, parents and guardians, well-wishers. Sir, permit me to present the newest doctors in the country today. Congratulations once again. Thank you very much.
Thank you very much. You can sit down, please. I wish to sincerely. Thank you very much.
This man is shit.
So we have very brand new doctors in town. Adinfe, oh yes, not for Megini. Thank you. I'm sure your parents must be very proud of you today. Very, very proud. Some of you, I can see bus load of people from your village. Possibly the first doctor in your village. Okay, there is an aspect that we need to fulfill, and that is the shaking of hands. The shaking of hands with the Vice Chancellor and the Registrar and other members of the high table. I don't know the names, how are they arranged? All right, please, while we get the name of the... Sorry, yeah, that's it. I have it here. The Honorable Commissioner for Health Dr. Moses Ekuma is represented by Dr. Aja Gabriel, Director of Medical Services. Please, welcome, sir. Please, can you rise and thank you, sir. It is my honor and privilege also to introduce Dr. Mrs. Queen Elizabeth Agbo, the Resident Electoral Commissioner, Anambra State, Dr. Olebe Augustine Obasi, Professor Anayo Joseph Orako is the new DAP of the university. Please take note. The new DAP of the university, Professor Anayo Joseph Orako. We have the former Honorable Commissioner for Health, Ebonyi State, Dr. Daniel Omezurike, now the Sub-Dean, Faculty of Clinical Medicine. He is here, Dr. Daniel Omezurike, please. Can you just wait? Thank you. And also have Dr. Opala Francis, the HOD Radiology, also here. Please, can you just wave, sir? Thank you. May I also recognize the presence of Mrs. Henrietta Okoro, the brand new college secretary. Please, can you rise, man, and wave? Thank you. All right, can we take the graduates now? All right. Ago Nkiruka Michael, Rachel, please, can you clap for her, walk through, and then shake hands with the VC and the registrar. Please, Igwe Timothy Monday should follow. Eze Sunday Igurube should follow, please. I'll be fast about it. Elebe Confidence Chinaza. Elebe Confidence Chinaza. Nwankwo Izuchukwu Joseph. Nwankwo Izuchukwu Joseph. Eba Obiora Paul. Nwaofe Kingsley Ikenna. Annie Sandra Kosisochukwu. Okay, Chika Odele Alexander. Okay, Onyebuchi. Please be careful so that we don't have a repeat of the last incident, last ceremony. Wibo Samuel Emeka. Mwagu Monday Chinaza. Odi Daniel Obonna. Abba Fidelis Jojubu. Opala Davids Chukunonso. Edgar Peter Kelechi. Nna Chieze Ozioma Chihurum Nanya. Ogoro Chidi Stanley. Ota Chibogo Solomon. Ododo Ugochukwu Chibweze. Ogoro Livinus Ola. Abba Chijioke Jackson. Abba Chijioke Jackson. Babatunde Benga Samuel. Uzo Joseph. Obuinya Precious Uchechukwu. Nwoke fọrọ Barnabas Uchechukwu. Baba Banley Motulewa Precious, I got that right. Chukwueze Richard Ikechukwu. Eza Horokwe Arinze Emmanuel. Ngene Prince Christopher. Ali Collins Nkemderem. Abo Elom Chibuike. Usman Umeiza Abdul Malik, Usman Umeiza Abdul Malik, Igwe Chukuma Collins, Afabi Agabi Blessing Ogu Opa Nneka Katina Aliona Ikechukwu Elijah Ulebe Sebastian Uchenna Nwale Valentine Ebuka Nwoko Ifeanyi Joseph Nwoke Chukwu Ebuka Chibuike Ngele Henry Nnemeka Iteshi Clayton Oshim Chibueze Kingsley Ewuzie Chinonso Augustine Nwobala Stephen Mbam Acho Innocent Ofobuike Amobi Tochukwu Stephen Mbam Ogochukwu Simeon Ishali Benedict Emeka, and lastly Nweke Paulinus Ugochukwu. Thank you so much. I'm sure it's a very special moment in the lives of these young ones, the families who must be very proud of them for this very all right, having dispensed with that ceremony, wish to move on as I invite the chairman of the Nigerian Medical Association Ebonyi State Chapter, Dr. Charles Maduba, to please come and admonish them. Please, a round of applause for your chairman. Thank you, sir.
Vice Chancellor presented by EBSU the EBSU registrar, Dr. Fatima, presented by Dr. Tijani, the provost of the college, other principal officers of both the college and the university at large, the CMD of AFUTA, Professor Robinson Ono, presented by the CMAC, Dr. Jenna Webu. Other distinguished ladies and gentlemen, parents of the brand new doctors and the brand new doctors, it is my pleasure to stand on behalf of the Nigerian Medical Association to perform an induction of our new members. This is addition of 55 new doctors into our fold, and that is a promise for fulfilling the core aspirations of this association, which is providing qualitative healthcare services. Today, you are switching from student membership to physician membership of the Nigerian Medical Association. So we encourage you to identify with NMA. The usual feeling is that it's about unionism. but that is not the truth. NMA is committed to improving the quality of medical education, working hand in hand with National Postgraduate College and the universities, as well as the MDCM. We achieve our goal of ensuring qualitative healthcare service through continued professional development, advocacy, policy development, knowledge management, and public education in collaboration with all these partners. NMA has 36 state branches and FCT. So wherever you are encouraged to identify. You're already a member by your practicing license. Actually, 70% of your practicing license goes to the Nigerian Medical Association. Only 30% goes to the MDCM. That's to tell you how much stake you have in the Nigerian Medical Association. You are also encouraged to identify with the affiliates, and that usually starts with a National Association of the Resident Doctors, but with the caveat that during your house job year, we do not encourage you to join any strikes because it can have effects on your training and at the same time affect you in some other ways. So please, the 12-month training should be 12 months. Don't interrupt it. We always have understanding with ALD to ensure that you are exempted during the industrial action period. Now, having been sworn in as doctors, I will perform the induction aspect. So I would like you again to stand up, put your hand on your chest, and then repeat after me the induction pledge. So you just mention your name again. I, Dr. You mention your name and then you follow through the pledge. Let's go. I, Dr. Do solemnly affirm that I shall be a responsible member of the Nigerian Medical Association and bear true allegiance to her. I shall project a positive image of the association in my life and in my practice. I shall abide by the Constitution of the Nigerian Medical Association and codes of medical ethics. I shall defend the honor and noble traditions of medicine and not bring the medical profession to disrepute. All these I pledge upon my honor. Thank you. Congratulations, brand new doctors. You are welcome to NMA. Let's give them a round of applause as they sing.
You know, today is just meant for induction. Induction 1, induction 2. Mark. Honorable Commissioner, a big man, he can talk from here, but you would like the project. Let me just talk from here. Once more, my remarks will actually, if you permit me, I will stand on the existing protocols so that more brief. My job here is just to congratulate the newly graduated doctors. Can't congratulate you enough. We know the campus response. Congratulate your parents. We can't congratulate them enough. Congratulating them. They've done so much. So you will always, when we finish congratulating them here, you will keep congratulating them when you go. Then we also congratulate the teachers, management of teaching hospital for turning up
very high quality doctors that we have been doing. And the doctors from the EBSU actually the quality ones for those of us that, and may God continue to bless you. Thank you, Lord.
You know, when government visits, they always bring good news. So this one is a very good piece of news. Ladies and gentlemen, I know that for so many of you, rice and stew, very plenty at various points. So to you, we are wasting your time, some of the parents. So we are gradually coming to the end, but not without inviting So may I invite the Dean, Faculty of Clinical Medicine, Professor Njoko Isaac Omoke, to please give the vote of thanks.
The chairman of the occasion, the Vice Chancellor of Ebonyi State University, Professor Michael Gucha Awode, will be represented by Professor Michael Ajawanchukwu, the distinguished Professor Michael Ajawanchukwu, the DVC administration. I stand on the already existing protocol. For want of time, we give this vote of thanks. First of all, our thanks goes to the Almighty God for making today's event the reality. We thank God also for being the unseen hand that guided and protected our latest set of medical doctors as they navigated the pathway of medical education. Give thanks to our visitor, His Excellency, Right Honorable Hilda Francis Bonayamwifu. We cannot thank him enough for his incredible support to our medical school. The peaceful environment in Ebonyi State that significantly reduced the burden of medical education among our students is not taken for granted. So we thank him and may God bless him. We also thank the chairman of this occasion. We thank our Vice Chancellor of the University of Ebonyi State University, and all the principal staff of the university that are working in union with him for today's occasion. We appreciate him. He has done so much for us within a few weeks of the inception of office. He has done so much for the college, and we thank him and say, may God bless him. The Registrar of Medical and Dental Council of Nigeria, Dr. Fatima Kaire, will be represented by Dr. Tijani Madaka. Thank you for giving us a date again. He was here in December, about 3 months ago, and he's coming back again to see to the success of today's occasion. So thank you very much. As you are going back, God bless you and grant you journey mercy. So our Provost of College of Health Sciences, distinguished Professor B.C. Begwe, we thank you for ably piloting the affairs of the college. I must say that your steady hand has kept the college flying and producing high-quality medical graduates. May God bless you. I want to thank all our deans, the HODs and lecturers. We appreciate all your sacrifices and selfless services that most often entails going extra mile to teach, mentor, and advise the medical students entrusted in our care. May God bless you.
Nwoko Ifeanyi Joseph, Nwoke Chukwuebuka Chibuike, Ngele Henry Nnemeka, Iteshi Clinton, Oshim Chibueze Kingsley, Ewuzie Chinonso Augustine, Nwobala Stephen Mbam, Acho Innocent Ofobuike, Amobi Tochukwu Stephen, Mbam Ogochukwu Simeon, Ishali Benedict Emeka, and lastly Nweke Paulinus Ugochukwu. Thank you so much. I'm sure it's a very special moment in the lives of these young ones, the families who must be very proud of them for this very All right, having dispensed with that ceremony, we wish to move on as I invite the chairman of the Nigerian Medical Association Ebonyi State Chapter, Dr. Charles Madoba, to please come and admonish them. Please, a round of applause for your chairman. Thank you, sir.
Vice Chancellor, presented by EBSU the MPCM registrar, Dr. Fatima Dari, presented by Dr. Tijani, the provost of the college, other principal officers of both the college and the university at large, the CMD of EFUTA, Professor Robinson Ono, presented by the CMAC, Dr. Jenna Webu. Other distinguished ladies and gentlemen, parents of the brand new doctors and the brand new doctors, it is my pleasure to stand on behalf of the Nigerian Medical Association to perform an induction of our new members. This is addition of 55 new doctors into our fold, and that is a promise for fulfilling the core aspirations of this association, which is providing qualitative healthcare services. Today, you are switching from student membership to physician membership of the Nigerian Medical Association. So we encourage you to identify with NMA. The usual feeling is that it's about unionism, but that is not the truth. NMA is committed to improving the quality of medical education, working hand in hand with National Postgraduate College and the universities, as well as the MDCM. We achieve our goal of ensuring qualitative healthcare service through continued professional development advocacy, policy development, knowledge management, and public education in collaboration with all these partners. NMA has 36 state branches and FCT. So wherever you are encouraged to identify. You're already a member by your practicing license. Actually, 70% of your practicing license goes to the Nigerian Medical Association. Only 30% goes to the MDCM. That's to tell you how much stake you have in the Nigerian Medical Association. You are also encouraged to identify with the affiliates, and that usually starts with a National Association of the Resident Doctors, but with the caveat that during your house job year, we do not encourage you to join any strikes because it can have effects on your training and at the same time affect you in some other ways. So please, the 12-month training should be 12 months. Don't interrupt it. We always have understanding with ALD to ensure that you are exempted during the industrial action period. Now, having been sworn in as doctors, I will perform the induction aspects. So I would like you again to stand up, put your hand on your chest, and then repeat after me the induction pledge. So you just mention your name again. I, Dr. You mention your name and then you follow through the leg. Let's go. I, Dr. do solemnly affirm that I shall be a responsible member of the Nigerian Medical Association and bear true allegiance to her. I shall project a positive image of the association in my life and in my practice. I shall abide by the Constitution of the Nigerian Medical Association and codes of medical ethics. I shall defend the honor and noble traditions of medicine and not bring the medical profession to disrepute. All these I pledge upon my honor. Thank you. Congratulations, brand new doctors. You are welcome to NMA. Let's give them a round of applause as they sing.
You know, today is just meant for induction. Induction 1, induction 2.
some fun. Now you know.